Hi, fellow viewers, to everybody. Good afternoon. My name is Steve. My full name is Steve Hoong. I'm the owner of this video account in this respective website, youtube.com. By the way, my next necrological video is about a German psychiatrist. Can I ask you something? Are you familiar with this disease from past until present that is called Alzheimer's disease? I'll repeat. Alzheimer's disease. Are you familiar? If your answer is yes, then this is about him. This is about the German psychiatrist, no other than Alois Alzheimer. Don't you worry, I will mention it in the title of this video. By the way, who is he? And how did he become a psychiatrist? And why is it that his family name become well known until present, this kind of disease? What did he discover, and why is it he called as the father of dementia research? I will answer that. By the way, I'll give these important necrological details from his birth until his death, educational background, and what did he achieve. Okay. Alois Alzheimer, known as his real name is known as Aloysius. He was born on June 14, 1864 in Markbeit in Bavaria, that is located in southern Germany. He died on December 19, 1915 at age 51 in Breslau, Silesia, which is now the present day called Wroclaw in Poland. The spelling is Wroclaw. By the way, 4 days after his death, he was buried in Frankfurt main cemetery besides his wife Cecily. He married only once, then he survived 3 children. No details was mentioned if it is male or female. It's only mentioned 3 children. Okay, that's it. By the way, he was called father of dementia research because he was the pioneering in his medical works in identifying and describing the brain changes associated with the dementia. This is the one we are talking about. I'm referring to the Alzheimer's disease. By the way, a lot of you are asking, is dementia and Alzheimer's disease are similar or the same? The answer is yes, they are the same. Even if their names are different, although they have their similarities and a little differences. So that's it. By the way, the cause of death of this German psychiatrist is due to streptococcal infection that leads to heart failure. He died on the heart failure in Poland, Wroclaw, Poland. Although he was buried in Frankfurt main cemetery in Frankfurt, Germany, 4 days after his death. He is known for having a variety of medical interests, including vascular disease of the brain, early dementia, brain tumors, forensic psychiatry, and epilepsy. His profession is German physician. Later on, I will mention in the description in this video, German physician. He is also his specialty as a psychiatrist and neuropathologist. By the way, if this is about neuropathologist, this can be considered as neuroscience research. Okay. By the way, as his profession as a psychiatrist, he had a colleague named Emil Kraepelin. Emil Kraepelin, he is the father of modern scientific psychiatry, and he is also the psychopharmacology and psychiatry genetics. Emil Kraepelin. That's it. At present times, the pathological diagnosis of Alzheimer's disease is still generally based on the same investigative methods that is used in 1906, meaning from past until present. This is the most remarkable compared with the development of investigative methods for the other diseases, and speaks volumes about the quality of Alzheimer's discovery. By the way, this German psychiatry is his subspecialty is more on neuropathology. Neuropathology. By the way, he is credited with identifying the first published case of presenile dementia, which Kripelin, the one I mentioned a while ago, Emil Kripelin later identified as Alzheimer's disease. He's the one who declared this disease Alzheimer's disease. That's the reason why until present this disease is well known until present. I'm talking about 2025. By the way, his parents is Edward Roman Alzheimer, which is his father. His mother is Anna Johanna Barbara. Uh, on his educational background, he studied medicine in the University of Berlin, University of Tübingen, and University of Würzburg, in which he received a Doctor of Medicine degree in 1887. So that's it. On his personal background, he married once and no other than Cecily Simonette Natalie Geisenheimer. They married in 1894. So therefore, he is just only 30 years old that time. Then they bear 3 children. That's it. I have some bad news on this German psychiatrist's wife. His wife just lasted only 7 consecutive years because she died on 1901. Of course, she was buried in Frankfurt Main Cemetery in Frankfurt, Germany. So that's it. Aside from his wife died, 1908 he became a professor of Ludwig Maximilian University of Munich. Munich is located in Germany also. Then 1912 he became a psychiatry professor in which there are 3 institutions that he was recognized. First is he was recognized in Institute for the Insane and Epileptic, which is a German word called Irrenschloss, Irrenschloss. Then second is Frankfurt Ludwig Maximilian University of Munich. That is the recognized institution. The third and the last institution that he was recognized is in Silesian Friedrich and Wilhelm University in Breslau. That is the one I mentioned in Wrocław in Poland. So that's it. By the way, in his first patient that happens in 1901, Dr. Alzheimer observed a patient at the Frankfurt Asylum named a female, a female prisoner named Frau Augustdetter, Frau Auguste then Detter. He found out something that is very unusual. This is what he found out. She was not like that other patients, which is ordinary, but this one extraordinary. She was suffering from symptoms that defied conventional medical explanations. That is not common to the other prisoners, meaning what he found out was he experienced severe memory loss, or that time I'm not so sure if they called it amnesia that time. Then there was aside from memory loss, they found out she had a confusion and behavioral changes, so meaning unusual. So that's it. She had a progressive confusion, sleep disorders, and most importantly, memory loss. So that's it. Then he did not expect that his patient, Detter, died on April 8, 1906. So meaning he discovered that prisoner in 1901. So it took him 5 consecutive years. So Detter died that time. Then her medical records and brain brought to Munich, where He has worked in Crepelin Laboratory, the one Emil Crepelin Laboratory. With two Italian physicians, he used the newly developed Biel-Chomsky stain to identify amyloid plaques and neurofibrillary tangles. These brain anomalies became identifiers of what is now known as Alzheimer's disease. That's the reason why this disease is became what do you call this common disease in the whole world. By the way, a lot of you are asking, even if this person, German psychiatrist, died already, in 2025, is there already a medicine? Actually, in terms of treatment, there is already a treatment. Okay. Actually, it's based on my necrological findings and necrological research. If doc, if Dr. Alzheimer was alive that time, he might discover this cholinterase inhibitors. If he discovered this, so there is already a medicine which is a first treatment plan called donepezil, rivastigmine, galantamine. So these are three medicines that is related to Alzheimer's disease. Actually, these inhibitors is to prevent the enzyme cholinesterase from destroying the acetylcholine molecules that is found abnormally in small quantities in the brains of the patient, meaning the brain, the patients with Alzheimer's disease. So therefore, in my analysis, when we talk about Alzheimer's disease, meaning this is the person who forget already. This is not about absent-minded. So that's it. Okay, so aside from that, after Detter died on November 3, 1906, he discussed findings on the brain pathology and symptoms of the presenile dementia publicly, which was held in the Tübingen meeting with the Southwest German Psychiatrist. That was the main event happened in November 3, 1906. Okay, so I hope that this necrological video is we already found out that this is the German psychiatrist that derives from this word Alzheimer's disease. Okay, so this is me, Steve Hoong, your world's famous necrologist, is saying goodbye in this video. Don't you worry, there will be more necrological videos to come, so don't forget to subscribe and click the notification bell for my next necrological videos. Thank you so much for listening in this video. Good afternoon. And all the details, the important details that I mentioned will come out in this description. So nothing to worry. And there is also hashtags, the deaths, obituaries, and when this person died, it will come out. So the hashtags still exist. Nothing to worry. Thank you so much for listening in this video. Good afternoon.